So welcome back. Can you hear me? So now we'll discuss some important thrust areas in all the 12 subjects. And before that, I would like to answer some questions raised by Dr. Kushmeet. So last year I had given the exam in AIAPGET. Problem comes that you got the rank in list, but this rank you are eligible in which college is not given in any of the website. So as per the current guidelines, we are operating. It's a tough or difficult task also. We also given a representation to the government that we have to correct it. It is better to have a national level this interview also. I mean the admission. So if you have a national level examination, it is better to have a national level admission also. Otherwise, how to apply to all the states, and some of the examinations interview may be in the same dates. So there are a lot of conflicts are there. So probably that will be resolved in the near future. Now we'll so the cutoff mark is 50 for all the candidates appearing for the examination. That's applicable for candidates as per the directions. As per the current directions, 50% is a cutoff mark. And the tips for the last 15 days, Dr. Grishma, I will give you. Don't worry, we'll discuss that the last 15 days also. One by Dr. Kajal Krishna, mother of one baby, sir, completed PG from BBSR. Okay, very good, very good. Now full-time babysitting, feeling frustrated, but now feeling boosted. Okay, Kajal Krishna, wish you all the best. Yes, Dr. Kushmeet, the colleges should give information that which rank that will try this year. Okay. And by question by Dr. Mamata Patel, can we get the recordings of the webinar? Yeah, definitely you will get the recordings of the webinar. Go through each and every point in the slides later. No, don't worry. So now we'll discuss some important thrust areas in different subjects. And another question, what should be the GK for Kerala PSCs? Any specific areas of concern, how much questions? Yeah, that's nearly 20% of the question we can expect from the general knowledge. And all this general knowledge and regarding this Renaissance, Indian history, everything is compiled in our homeobook.com. You can download it later from homeobook.com, GK for PSC. Nafisa, they will inform you about the recording. So the Materia Medica, there is some important thrust areas in all the 12 subjects. And as I said earlier, Allen's keynote, you must be thorough with each and every word from A to Z in Allen's keynote. And they will ask mainly from the relationship section. Number of questions they will come from the relationship section. So remember about that, and you have to remember about the common name and the family-wise study also, like the common feature of acid and group, or the common features of ophidia, like that they will ask. So the family-wise study, that is essential. And you have to study thorough with the unique symptoms. I will give an example. A hard-boiled egg has lodged in the pit of the stomach. Can anybody give the answer? Unique symptom of a particular remedy that is not available in any other remedy. So this type of question they will ask. Unique symptom. A hard-boiled egg has lodged in the pit of the stomach. Which abyss? Abyss nigra or abyss canadensis? Both will be in the question paper. Abyss nigra or abyss canadensis? Answer is abyss nigra. So this type of unique symptoms we have to study in Materia Medica. And suppose if you are studying the source book in Materia Medica, you have to study like this. The encyclopedia, for example, the Encyclopedia of Pure Materia Medica by T.F. Allen. Remember, there are many other Allens are there, H.C. Allen, W. Allen, etc., etc. So remember which Allen and the full name of the book, its year of publication, a number of volumes, number of drugs. This will usually ask in examinations. Year, number of volumes, number of drugs. They will ask in the examination. So like in this method, you have to study the source book. Give special attention to Borix Materia Medica also. And in Borix Materia Medica, the most important area is the introductory paragraph of edema. That is the heart of that remedy. Give importance or special attention to the introductory paragraph in Borix Materia Medica. Remember, that is the heart of that particular remedy. Then italicize the symptoms. The symptoms given in the italics. And thirdly, you have to give importance Relationship of remedies in Borix Materia Medica 2. Relationship of remedies in Borix Materia. This is the criteria. Special attention to the introductory paragraph. Then symptoms given in the italics. And thirdly, the relationship of remedies. That is very, very important in Borix Materia Medica. And one question by Dr. Question they will ask on source book. There is no division of question. That is the main thing. Suppose they will ask a lot of questions from Organon, less question from Materia Medica. That everything that depend upon the subject expertness of that particular teacher preparing the question. That is only criteria. Currently, we have no division for AIAPGET. Okay, Dr. Nagaraj, I think you got the idea. And I will give some good questions from the dose and potency from Borix Materia Medica. So what is mentioned about the sorinum, and that is usually found in many question papers also regarding the dose and potency of the sorinum. Can anybody answer the dose and potency? I will read from the last. Can anybody answer which potency that is mentioned by Boric? Yes, very good. Dr. Urlan has given this correct answer. That's a 200. That is a potency. So I will read from the Boric. 200s and higher potencies should not be repeated too often. Sorinum requires something like 9 days before it manifests its action. Other symptoms lasting for weeks. So in the question paper, you will get like this. Dash requires something like dash days. The question paper, dash require something like. So sorinum requires something like 9 days before it manifests its action, and even a single dose may elicit other symptoms lasting for weeks. So the remedy, that is sorinum, and that is given by the author HED. So you go through the page number 534 in Borix Materia Medica. You will read. So that is mentioned. So what actually mentioned in Borix Materia Medica or Allen's keynote, as such, you will find in question paper. Now, what about the dose and repetition of the sepia? And one more thing, one question I found in majority of the question paper from sorinum. This patient will never improve while using coffee. Which is that medicine? There is only one remedy mentioned in Borix Materia Medica. But I don't know, majority of the not allowing the patient to take coffee. In Borix Materia Medica, that is mentioned only in one place. That is, this patient will never improve while using sorinum also. That's question asked in many competitive examination in the state and national level also. Now, what about the sepia? Sepia, the dose and potency, what is mentioned in Boric? As such, you will find in the textbook also. That is mentioned it as? Yes, very good, very good. 12th, 30th and 200th potency should not be too low or to be repeated too frequently. But another author, on the other hand, Dr. Jauset's unique experience is that it should be continued for some time in strong doses. That is 1x twice a day. You can expect that word in a question paper. Okay. Now, what about the repetition of lachesis? That is also something unique like sorinum. Sorinum mentioned it as 9 days it required to act. But so what about the lachesis? I will read from the lachesis. Anybody answer? It's a particular word that is mentioned in Borix Materia Medica regarding the lachesis. That is why that's found in the question paper also. Not 20 to 30 days, Dr. Pingy. I will read it. 8th to 200th potency ought not be repeated too frequently. If well indicated, that is more important. If well indicated, a single dose should be allowed to exhaust its action. That is mentioned in lachesis. That is you will find in question paper also. So you have to fill it as lachesis. A single dose, if well indicated, a single dose should be allowed to exhaust its action. Okay. Now what about the maculatum? To give some examples. Conium maculatum. What about the dose and repetition of hypertension, fibroadenoma, fibroid uterus, etc., etc. So what is specifically mentioned about the dose and repetition of the conium maculatum in Borix Materia Medica? And you will find these words as such a question. I will read. Best in higher potencies given infrequently, especially for growth. Especially for growth means fibroadenoma or uterine fibroids, you should not repeat it often. That should be prescribed in higher potencies. In paralysis also, in paralytic state, also. Otherwise, 6th to 30th potency. So for paralysis and growth in cornea maculatum, we have to repeat it. Higher potency should not be repeated often, but should be prescribed in higher potency. Now, what about the remedy causticum? Causticum in Borica Materia medica. That is mentioned in that the causticum that should be repeated in higher potencies very often, especially in the case of paralysis. That should be repeated very high potency in weekly doses of causticum. Then only it will act in paralysis, but in weekly doses. Now, what about the eel serum, the remedy? Eel serum. What is that? Is serum angular ichthyotoxin. That is a remedy. Serum angular. That is something peculiar about this dose and repetition. That is why I am asking. Eel serum, serum angular ichthyotoxin. What about the dose and potency? Yes, Dr. Shadina Safir, very good. 1:3 in heart diseases. Eel serum or serum angular ichthyotoxin should be repeated in lower 1x or 3. In cardiac cases, that should be the serum angular ichthyotoxin should be prescribed in lower potency. But in heart diseases, the serum angular ichthyotoxin that should be repeated in higher potency. So the edema will come both by the. So in cardiac cases, eel serum that should be repeated in higher potency, but in lower this renal cases. Now, what about the repetition of bladder? That is mentioned in our literature. Bladder that should be stopped when the action sets in. That is the word used. You have to stop that remedy when the action sets in. Now, what about the calcarea carb? The dose and repetition. Dose and repetition of calcarea carb. That should be repeated frequently in children. Yes, very good. Frequently in children, but infrequent doses in adult cases. Now, what about the repetition of the tuberculinum? Anybody can answer, please? The repetition of tuberculinum. A specific word that is used in Boris Materia medica regarding the repetition of tuberculinum. Anybody? Dose and repetition of tuberculinum in children. Yes, very good. That should be repeated in frequently. This more frequent repetition in children than any other remedy. That is mentioned in tuberculinum. This remedy may require too frequent repetition in children than any other remedy. That is mentioned in Boris Materia medica. So, which is the next remedy after tuberculinum that is mentioned in Boris Materia? Which is the next remedy? Which remedy? That is if tuberculinum fails. The next line of remedy that is given in italics. Yes, very good. Dr. Avinash, syphilinum, and Dr. Poonam also given the correct answer. Dr. Mishra also given the correct answer. This is the next line of remedy if tuberculinum fails. And this is the reason I told the high-by mindset. If you are preparing for a competitive examination like this, your clinical knowledge will improve, your private practice will improve, definitely will improve. So that's the high-by mindset. Competitive examination. Very good. So something about the organon of medicine. You have to concentrate mainly on the aphorisms. Concentrate mainly on the aphorisms. They will ask around every nook and corner of the aphorism, and you have to study about the contribution, the life history of the Hanuman, including the contribution. They will ask from psora, syphilis, psychosis, and tubercular only. Not the latest miasms like there are a lot of other miasms like cancer miasm, other miasm, etc. That will not ask. They will ask psora, syphilis, psychosis, and tubercular miasm only. So thorough with that miasm and the concept of miasm by different and editions of the organon. Changes in the different editions of the organon. That you have to study thoroughly. I will give you some examples. And the details about the pioneers of homeopathy. Details about the pioneers of homeopathy. Who is the father of Indian homeopathy? Who is the father of homeopathy? Please give me the answer. Who is the father of Indian homeopathy? Yes, very good, Dr. Avinash, Dr. Divani, Dr. Rajendra Lal Datta. And Dr. Poonam also given the correct answer. Dr. Rajendra Lal Datta. That's the correct answer. And another question by Dr. Rai. What is the percentage of ratio of allied and homeopathic subjects in question paper? In AIAPGET and UPSC, that is not at all mentioned. The percentage. I will ask from any subject at any number of questions. So Rajendra Lal Datta is the correct. Indian Repertory. Father of Indian Repertory. Anybody please? Father of Indian Repertory. Yes, father of repertory in India. Yes, Dr. Poonam, you are correct. Dr. Prashant Kumar, everybody is correct. Father Augustus Muller. Father Augustus Muller. Very good. So like this, you have to study about the pioneers of homeopathy. Now, study the aphorisms like this. Number of aphorism in the first edition, that is 259. Second edition, 318. Third edition, 320. Fourth edition, 292. Fifth edition, 294. Sixth edition, 291. Study of aphorisms in each edition. And the omitted aphorism in the sixth edition, that is a 285, 89, 291, and 92. Omitted aphorisms in sixth edition, 285, 89, 291, and 292, like that. Then Sora is mentioned in which aphorism? Sora, that is mentioned in the aphorism number 80. 50 millisimal potency, aphorism number 270. Isopathy, aphorism number 56. Therapeutic law of nature, aphorism number 26. And mechanism of cure by homeopathy, that's in which aphorism? 29. The therapeutic law of nature you will get in almost all the question paper. That is aphorism number 26. Therapeutic law. Then magnetism and electricity, that is in 286 to 87. Mesmerism 288 to 89. So like this, you have to study the classification of disease, type of acute disease, that is in aphorism number 73. Type of chronic disease, that is in aphorism number 74. Chronic disease 77. True natural chronic disease. So different types of diseases: acute chronic, artificial chronic, false chronic, true natural chronic diseases. You have to study like this. And the record keeping, that is mentioned in the aphorism number 104. You have to give more importance to the history and evolution. History and evolution. You will get lot of questions from the history of the repertory, different types of repertory, their name, their authors, etc., etc. So history and evolution of the repertory. Then detailed evolution of the three, Boger and therapeutic pocket book. They will not ask from the synthesis repertory or Murphy rubrics from the synthesis or Murphy's repertory. They will ask only from the Kend, Boger, and Boningessen's repertories. So detailed study. And name and author of repertories. I will give a methodology how to study the. Then the year of publication. That I will ask. The year of the first edition, second edition, third edition, like that. And the symptomatology also. What is meant by a clinical symptom? What is meant by what is meant by a Sheen symptom? That you will find in many question papers. SC. What is meant by a Sheen symptom? Yes, Dr. Harika, you are correct. The symptoms appeared after the excessive administration of the homeopathic remedies. So in that case, what to do? We have to stop that remedy. That is mentioned in the Organon of medicine. So this type, they will ask questions like this from the symptomatology. Then rubrics with medicine. Remember, you just go through the last year UPSC question paper and Kerala PSC question paper. Also, you will get many questions, rubrics with, they'll ask medicines within a rubric. Yeah, that is the rubrics with the single remedy. Single remedy rubrics, they will ask. As in the case of benevolence, we already discussed it. And second one, out of 20 to 50 remedies or 10 to 15 remedies, only one remedy is 3 mark. They will ask like that. So, for example, in the oxalate of lime rubrics, that is urine sediment oxalate of lime. Suppose if your patient has a lot of calcium oxalate stones in their urine, we can take the rubric urine sediment oxalate of lime, which is the only 3 mark remedy out of 15, 20 remedies. Oxalate of lime, the rubric, the only 3 mark remedy, that is nitric acid. Similarly, the phosphate of lime, the only 3 mark remedy, that is a phosphoric acid. So like this, we have to answer for the question. One question by Dr. Farheen. Who is the father of repertory? Dr. Animan or Dr. Boningason? Who is the father of repertory? Haniman instructed Jar to complete a repertory. The father of homeopathic repertory. Boningason is the father of homeopathic repertory. Very good. Many answered. Very good. So rubrics with medicine. Remember. Now the methodology. Suppose if you are studying about the cancer repertory, you have to study. Can you give the full name of cancer repertory? Anybody without looking at the slide? Anybody please give the full name of cancer repertory? That is the repertory of homeopathy materia medica. Homeopathic materia medica. Repertory of homeopathic materia medica. Can you give the full name of TPB? Therapeutic pocket book. Can anybody give, please? That is you will find in question papers. The full name of TPB. Shajina Safir, the principles and practicability of homeopathic materia medica, the study of the physician in the bedside. That is the full name of therapeutic pocket book. Can anybody give the full name of bogus repertory? Bogus repertory, full name. The full name of bogus repertory. Boger-Boningason's characteristics repertory with index. Can you give the full name of synthesis repertory by Frederick Schoen's synthesis repertory? The full name of synthesis repertory. Yes, very good, Dr. Amanpreet. Boningason's characteristics and repertory. Boger-Boningason's characteristics and repertory. Yes. Full name of synthesis repertory. Synthesis. Anybody, please? Repertory. No. Synthesis repertory is something different. Yes. Repertorium homeopathicum syntheticum. That is the full name of Repertorium homeopathicum syntheticum. So what is the full name of synthetic repertory? Synthetic repertory. Full name of synthetic. Previously I asked about synthesis repertory. The full name of synthetic repertory. Synthetic repertory, that has no full name. That is a synthetic repertory. That is the only name. Synthetic repertory. Tester, you are correct. Synthetic repertory. So like this, you have to study the full name. Even though we are using that repertory or the Materia Medica textbook, we are not familiar with, we are not by hearting this the full name. So remember about that. Then author. I found this also, where that actually published. Then second edition 1910 published by Kent at Lancaster. Third edition in 1924 published by Eddard at Chicago. And fourth edition in 1935 February, Chicago by published by Clara Kent. Edition by Clara Kent. Fifth edition in 1945, edited and revised by Clara Kent and dedicated to Clara Kent, and it is published at Chicago. So which edition is dedicated to Clara Kent? That is the fifth edition of Kent's Repertory. Sixth edition, that is in 1957 at Chicago. Indian edition 1961. And seventh edition, it is otherwise known as Kent's Final General Repertory in 1974 by Perry Smith and Divan Harrison. Perry Smith and Divan Harrison. Studying a repertory. His source book, his full name, his different editions and published work. So like this, you have to study the other repertory and Materia Medica books also. And you will definitely get one question from NER repertory. You will find in every question paper, you will get, because that repertory is something unique. So that is why in each question paper, you just go through it, you will find one question from NER repertory. And I will ask some common questions also. I will give that question now. Guiding symptoms of our Materia Medica. Author Clavin B. Ner. Clavin B. Ner is the son-in-law of Herring. Clavin B. Ner is the son-in-law of Herring. And the first edition that is published in 1896, that contained 428 medicine. Remember the name of the number of medicine. So, one volume only, but in Generis Concordance Repertory, that is 6 volume. So in this case, only 1 volume and 48 chapters and gradation 4. Remember all these things: number of medicine, the volume, the chapters, gradation. As I said earlier, examination is nothing but recall of memory. So the gradation, double thick line, most frequently verified by QS. Dr. Poonam, as far as my knowledge, that is a 428 medicine. Anyway, please check it. Double thick line, most frequently verified by QS. Or verified on clinical practice. They will ask like this. The single thick line denotes remedies confirmed or verified on clinical practice. And normal double thick line, that is occasionally verified. Single line, less occasionally verified. Hand mark. NER denotes cross reference. Hand mark in NER repertory denotes cross reference. Then theta mark. That is symptom standing between the cured and the pathological condition. Theta mark in NER repertory denotes standing between the cured symptom and the pathological condition. Theta mark denotes. And a horizontal line, symptoms observed in the sick only. Then then colon with horizontal line, that's a perpendicular dotted line. That means the marks that observation taken from the old school. Such harmonize with our law of cure. Observation taken from old school, that is a perpendicular dotted line. Then T, that denotes for the toxicological extract. Anyway, please refer the number of medicines in NER repertory. Somebody commented as 408 medicine. Anyway, you just refer it from authentic textbook. Thank you, Dr. Aman and Harika for giving this suggestion. Now you will get one question from card repertory. Will ask only question from that 2 slides, nothing else other than from NER repertory. In card repertory, you have to study like this. Who is invented the first card repertory? That is by William Jefferson Guernsey, the first card repertory. The first Margaret Taylor. First punched card repertory by Margaret Taylor. Which card repertory is known as magnum opus? Field's card repertory is known as magnum opus. Then 1928 by Bogus card repertory. Then who introduced the gradation? That is in 1948. Who introduced the gradation in cards? That is by Marcos Geminis. And 1950, the Shankaran's card repertory. Jugal Kishore, that is the biggest card repertory, that is by Jugal Kishore. But the biggest card repertory, that is by Jugal Kishore. That is in 1959. and Sharma's card repertory. Like this, you have to study the card repertory. As I said earlier, the reading and preparation is entirely different from that of university examination. And we are giving you this by examination at the state and national level. And they will ask something about the latest repertory. So only the year or name author. Otherwise, no rubric from synthesis repertory or synthetic repertory they will not ask. But they will ask the name of the textbook or author. Kent's Repertory General by Jos Kunsley. That is a very good book. Then synthesis. The name of the repertory is Repertory Homoeopathy Syntheticum. The author Frederick Schoens. That is based on radar. Suppose they will ask the questions like this: which repertory is based on radar? So synthesis repertory. Then comparative repertory of homeopathic materia medica by Dox and repertory and the author also. So this is a method about the studying the repertory. Then homeopathic by Robin Murphy. Complete repertory by Roger van Zandervoort. Repertorium Universalis by Roger van Zandervoort. That is another name for the complete repertory previously. So, Dr. Amar Preet, another question. 7th edition. That is, we have a slide. 7th edition. Kent's Final General Repertory. Kent's Final General Repertory. Dr. Aman Preet. And Dr. Kohli, one question: what is a word macum? That I have to refer the exact meaning. I will give you now itself. That I have to refer. And you will get now we will discuss some rubrics. And all these rubrics and this their meaning that is available in the latest version of the Homeo that you will get freely for 90 days now itself. Can you give the rubrics? Where will you get the rubric for the hoarseness in Kent's repertory? The rubrics for the hoarseness in which chapter of the repertory? Make it fast. And we have to discuss some more points later. Yes, very good, Dr. Divyani. That is available in the chapter larynx and trachea. Dr. Jauhara also given the correct answer. The correct answer. You are very thorough with repertory. Where will you get the rubric? Child grasp the nurse when carried. Child grasp the nurse when carried. Where will you get that rubric? Child grasp the nurse when carried. In which chapter? Yes, Kohli, you are correct. Rubric. Child grasp the nurse when carried. Yes, Ramya, Dr. Amrita, everybody is correct. So in which chapter you will get the rubric lice? Lice. This question you will find in question paper about the lice. Head only. But the lousiness, tendency to lice formation, that is available in which chapter? Lice is available in head chapter, but lousiness, tendency to formation of lice. That is you will find. Yes, you are right. Dr. Rabiha, Dr. Jauhara, Dr. Verma, etc. That is available in chapter lousiness. That is available in the chapter skin. Skin is the chapter. Very good, Dr. Sahu, Dr. Shafir, Sajina Shafir, etc. And where will you get in which chapter? Bed sore. That is in the chapter. Yes, that is in the chapter skin. Skin sore become SORE. That is a rubric. Now, where will you get the rubric for burns? Generalities. That is my question. Whether the burns rubric is available in skin or general chapter. For the that is available in the female chapter only, not in male, not in generalities chapter. Only in female sterility, not even in the male chapter, not even in generalities. So where will you get the rubric for sinusitis? Sinusitis. Yes, very good. That says chapter is nose. Nose coryza extending to frontal sinus. Nose catarrha extending to frontal sinus. You will get in nose chapter of cancer repertory. So like this, you have to study the rubrics. We have discussed. So where will you get the rubric for inguinal hernia? In which chapter? Yes, Dr. Moman colleague, you are correct. Abdomen. Abdomen is the chapter for inguinal hernia. Reverse peristalsis. In which chapter? Whether it is in the abdomen, the stomach, or in the rectum, or in the stool. Reverse peristalsis. In which chapter? The chapter is abdomen. Abdomen. So which is the rubric for premature ejaculation in cancer repertory? That is in the genitalia male ejaculation Q2. Genitalia male ejaculation Q2. And where will you get the rubric for epigastrium? Epigastrium. In which chapter you will get? Yes, Many has given the correct answer. That is, epigastrium means stomach, not abdomen. Stomach is the correct answer. Sciatica in which chapter? Sciatica. Sciatica in which chapter of the repertory? Sciatica, that is in the extremities chapter, not in the back, that is in the extremities chapter. Where will you get the rubric for lumbago? Lumbago. Rubric for lumbago? Yes, very good. That is in the back. So, buttocks in which chapter? Pain in the buttocks or nates, NATES. In which chapter? Pain in the buttocks or pain in the nates? Sorry, that is given in the extremities chapter. All the complaints related to the nates or buttocks, that is in the chapter extremities, not the extremities chapter. So malaria, the rubric for malaria? Yes, Shajina, you are correct. Rubric for malaria. In which chapter? Yes, very good. Fever. What is the rubric for malaria? Fever. The rubric for malaria in fever chapter. What is the rubric? Fever. Intermittent. That is the rubric for malaria. Fever intermittent. Very good. Now, angular stomatitis. Where will you get? Angular stomatitis. Where you will get the rubric for the angular stomatitis? Ulcers on the corners of the mouth. Where is the chapter? Sorry. Ulcers on the corners of mouth. That is in the chapter face, not in the mouth. Angular stomatitis means ulcers on the corners of the mouth. That is in the chapter face and mouth. So like this you have to study. Then some denotations. That is usually we will get from the Materia, medica, Organon and Repertory, like that. I will give one example. The need of the repertory comes from the character of homeopathy itself. The need of the repertory comes from the character of homeopathy itself. True, some men do some good work without a repertory. They also do more poor work than they would do with it. That is captioned by Kent. So like this, the pioneer's caption you have to study. That is another method. Then nodosities. What is meant by arthritic nodosities? What is the meaning of arthritis? That is the rubric is there in extremities chapter. What is the denotation? Denotations mean of arthritic nodosities. Yes, very good, Dr. Shajina Shafir. The correct answer is gout. Can anybody give the correct concerned rubric in bogus repertory for arthritic nodosities? Corresponding rubric for arthritic nodosities. That's a bogus repertory. Yes, very good. That is the lower extremities podagra. Podagra. P-O-D-A-G-R-A. Lower extremities podagra is the correct answer. And where will you get the rubric for a milky fever? In which repertory you will get the rubric milky fever? And the milky fever. In which repertory? Yes, very good, Avinash. The BBCR. BBCR. Dr. Hariga, you are correct. Sajina, you are correct. Yes. Jauhara, you are correct. BBCR. BBCR is a repertory. Milky fever means fever during lactation. And where will you get the rubric for it? In which repertory you will get the rubric for gonarthro case? The rubric gonarthro case that is there in Kent's repertory. The correct answer is Kent's repertory. Extremities, abscess, knee, gonarthro case. That's the rubric. That means tubercular abscess. Remember, gonarthro case means tubercular abscess. Miller's asthma, in which repertory you will get? Miller's asthma. Miller's asthma, the rubric that is there in, no, not, they will not ask a rubric from the Murphy, Dr. Subramanian Ken Boger. That is there in the repertory Boger, BCR. That means respiration asthma miliary. So what is meant by eye teeth? That is, this rubric is there in therapeutic pocketbook and Boger's Boarding Center BBCR. Eye teeth. Yes, very good. That is, the rubric is there in therapeutic pocketbook and also in BBCR. Now, what is meant by onyx? Onyx means the rubric is there in Kent's repertory. Eye onyx. What is the meaning of onyx? Yes, very good, Dr. Poonam. Yes, opacity. Nail-like opacity of the cornea. NAIL. Nail-like opacity of the cornea is onyx. Now, what is meant by sympathetic cuff? Sympathetic cuff. What is meant by sympathetic cuff? That's rubric is cuff sympathetic. What is meant by sympathetic cuff? Dr. Mino, that is not a nervous cuff. Sympathetic cuff means not involuntary, spontaneous. So sympathetic cuff means cuff in organic heart disease. Very good, Dr. Magna. Very good. Cuff in organic heart disease. That's the meaning of sympathetic cuff. That has no relation with the sympathy. That has no relation with the sympathetic system. Cuff in organic question paper like this. Now in pharmacy, we'll discuss something about the pharmacy also. Must be thorough with the drug preparation. You must be thorough with the drug preparation. The pharmacopoeia, different pharmacopoeia, Indian pharmacopoeia, British pharmacopoeia, Brazil pharmacopoeia, its volume, its number of drugs, etc., year of publication. Sources of drugs also. Sources of common drugs, not rare drugs, but common drugs. And the rules and regulations like the Drug and Cosmetic Act, Medicinal and Toilet Preparation Act, and also the one recent amendment in the Drug and Cosmetic Act, also that you in 2017, that you have to study. The recent and you have to name the alkaloid legs. Which are the alkaloids in belladonna? Atropine and hyoscyamine. Sometimes only hyoscyamine only in the textbook, not atropine. So the correct answer is hyoscyamine. So the alkaloid present in Naxomica, strychnine and brucine. Then the alkaloid present in Syngona, quinidine, quinine and syngonine. Three alkaloids are there. Quinidine, quinine and syngonine. And similarly in the epicac, emetine, ergotine is the alkaloid of cecal core. You have to study the common remedies, codeine and morphine. And also you have to study the abbreviations like AC or BID, Citodisp, and what is meant by DAB-ALT, Dr. Poonam, one question from Dr. Poonam, creosote, active principle. That you have to refer, Dr. Poonam. Don't exactly what's the active principle in creosote. So, abbreviations that you have to study. Then the class with this class method of preparation of the old class mother tincture preparation. Even though that we are not using nowadays, that you will get from many questions from this method of old class method of preparation. So class 1, class 2, class 3 like that. Class 3 means ratio. You have to study ratio, that is 1:2. And you have to study the drug strength also. That is 1/6. And common examples, the common remedies that comes under the class 3 preparation, that is pulsatilla. One question from interesting question from Fatima. In the old method of preparation, if not, then why it is asked? That is there in the question paper because that is included in the BHMS syllabus. If we know only the past, then only we can study or improve the present also. So that is why they are asking question even from the card repertory. Card repertory is an outdated one nowadays. At the advent of computer, our past, our history and evolution, then only we can improve our present condition and future also. So Dr. Shajina has given the answer for the creosote. Guaiacol. Guaiacol is the main content in creosote. Guaiacol is the main content in creosote. So like this, you have to study the class preparation. The method of preparation, the remedy, and the ratio, the drug strengths up to class 9. That's the method of preparation. And you have to study the drug and cosmetic role. Cosmetic, remember the role and act both are entirely different. The act, remember, Drug and Magic Remedy Act in 1954, but the rule is 1955. And similarly, there is a recent amendment in 2017 also, and the matter of the amendment, the date, and also the what they amended that you have to study from your pharmacy teacher. Then we will discuss. Roughly, I will give you the most of the questions from the practice of medicine, that is from the anatomy, that is from the cranial nerves and surface anatomy. But I never recommend only you have to read this one. Only with selective study is not good. But from the evaluation of the previous question papers, we found more questions from the cranial nerves, the anatomy part of the cranial nerve, and the surface anatomy. Which are the auscultatory areas of heart? Please answer. Which are the auscultatory areas of heart? Auscultatory. Area, then tricuspid area, pulmonary, aortic, and tricuspid area. Aortic area is situated on right or left? In second intercostal space, aortic area is situated in right or left? Yes, right. The left pulmonary. Similarly, the auscultatory areas of lung, like the inframammary, like that, we have to study the auscultatory, the surface anatomy. Then in physiology, they will ask about the physiological aspect of the cranial nerves. Then there are a lot of normal values that is mentioned in the physiology and biochemistry that we have to study, the investigation. And you will definitely get CG or JVP. So you must be thorough with that two part from the physiology. So you have to study the pathology, microbiology, and parasites. This is comparative study the common with the practice of medicine and also the social and preventive medicine. So it is very easy to study. In forensic medicine, you will get more questions from toxicology than the forensic medicine. You can expect more questions from the toxicology than the forensic medicine, and they will ask some questions from the ethics also. We find many questions from the fracture, calculi, and in obstetrics and gynecology, they will ask about the different toxemia, changes during pregnancy, and the process of labor. Toxemias, change, and the process of labor. Then in community medicine, nowadays many questions are we found majority of the question papers we found lot of questions from the social and preventive medicine. So one thing I would like to remind you that if they will ask about the questions from the health parameters, mortality rate or something like that, you always refer the latest census details.